ensures access to healthcare services without discriminations, requiring accessible communication methods such as sign language. Indonesia said give the accessibility and the communication for the deaf individuals using sign language, but how is the implementation in the healthcare sectors that I want to see? And the Article 21 mandates the training for healthcare professionals on disability rights and inclusive practices, including deaf cultures and Bisindo usage. So we will use the term Bisindo here. What is Bisindo? Bisindo is Bahasa Isyarat Indonesia or Indonesian Sign Language. So rather than telling Indonesian Sign Language this law, we call it in Indonesia as Bisindo. Okay? And Article 26 requires the provisions of sign language interpreters and other communication aids in healthcare settings to ensure effective communication. And the research design, the study utilized a descriptive research design. Primary data was collected and analyzed using straightforward statistical method to provide a clear interpretation of the findings. And qualitative data was gathered through survey questionnaires, and the results are presented in the form of frequency tables, percentage, and charts. And the sample of the populations are consists of deaf individuals who have access to healthcare services, including hospitals and clinics have engaged in communication with various healthcare professionals such as doctors, nurses, pharmacists, obstetricians, and gynecologists, psychologists, and other healthcare professionals. So this is how I do the data collection. Participants were recruited through deaf community organizations and social media, with inclusion criteria recruiting them to have had recent interactions with healthcare providers in hospital or clinics. The survey was administered both online and in person to ensure accessibility for all participants, utilizing a secure online platform to maintain the confidentialities were conducted either in person or via video call based on the participants' preferences and were recorded with consent and then transcribed for detailed analysis. Now I want to show you a video how I gathered the participants through social media. For your information, I'm also a content creator with 700,000 of followers on TikTok and 161,000 of followers on Instagram. So I make a content and then I get thousands of response to for people who want to be in this research. But after some the criteria, we only have hundreds of people to be our respondent. So I will translate, interpret what I say in sign language here, and you can see. Halo teman-teman tulis seluruh Indonesia. Wait, sekarang aku sedang butuh bantuan. Can we turn off the sound because it's in Indonesian? Yeah, turn off the sound first. Yeah, cool, thank you. Next. Hello, deaf people in Indonesia. Right now, I'm looking for participants, and I need deaf people who wants to be interviewed. That happens to meet the doctors, with the dentist or psychologist, or maybe you went to pharmacist to buy the medicine, or maybe go to surgery. I want to know about how the accessibility in healthcare for deaf people and how you communicate with them, because I want to research. And for those of you who wants to share your experience, please send me your name, and thank you. I will send you a DM message. Thank you. Bye bye. Information, and you can see here that I have 3,000 likes on this video and 113 comments, and 211 people shared this content. So I have a lot of participants joining from this one content, and I made two contents like this, looking for participants, and then I share the links to them, and then we do some research about how a good fit for the research. So this is what I do. Which is you can see from the red dots. So we have those deaf respondents and even Papua, but from 7 provinces, we only have 1 participants from that province. So this is one of the measurements that we see about the disparities of the deaf accessibility in the healthcare sectors in Indonesia. Most of them in Java, so our capital city is in here, and all of provinces in Java Island, we have the respondents because there's a lot of deaf individuals who have encountered with healthcare sectors in these provinces, and also in Sumatra. All of the provinces have the respondents, and I'm from Sumatra too, and I have a big so from this 138 respondents, we have this details of the gender distributions, and we have this 5 gender from male, female, transgender man, transgender female, and also non-binary. They identify themselves. We just gather the information based on this data also. Then the self-identity, most of them, back again, from the gender distributions, most of them are male, and the second is female, right? But then the second is about the self-identity. It's about deaf and hard of hearings. Deaf individuals identify themselves as deaf because most of them have severe hearing loss. Most of them use sign language, and it's hard for them to communicate in verbal, and almost hearing individuals, most of them can still hear voices, or some of them only deaf in one ear and another one can hear. Usage of hearing aid will help them to get sound, so they can hear sound, but it's different with the deaf individual. So most of them are deaf. 121 individuals identify themselves as a deaf and hearings. And then we see that the age distributions, most of them are from the age of 26 to 30, followed by 31 to 35. But only 2 persons in the age of 56 to 60. So it's quite a big range of the participants. And these are the communication preferences of the deaf and hard of hearings. And most of them say that they primarily use sign language to communicate in daily lives with their friends, their parents, their family. Most of them use 110 of them use sign language, but still use verbal communications, especially for those who are hard of hearings and maybe not in a social context, maybe they still need verbal communications, some gestures and writings. What is the difference between the sign language and gestures? Like sign language has their own patterns, their own grammar, which right? What is this? Yeah, you know that. What is this? Fever, yeah, state fever, yeah. That's gestures. Okay? But when we talk about the sign language, like talking about telling stories about I eat banana. If we use gestures, it will be like this. I eat banana. You know this banana, right? Right? That's gestures. but it's not how deaf communities communicate. Deaf communities, which they have their own, how to use the grammar in I eat banana. When you use the gestures, it will be I eat banana. Huh? You just open the banana. What did you eat? Right? In the sign language, the grammar will be like this. We open the banana, then we eat, right? Because it's visual. So it's the difference between gestures and sign language, right? So when we have definitions of this, and can understand how to communicate with the doctors, pharmacists, and other healthcare sectors and professionals in Indonesia. And yeah, most of them use sign language, verbal communication. It's clear that only 39 individuals use writings to communicate in daily lives. But how our findings when it talks about the healthcare sectors. These are the healthcare facilities. Most of them are going to pharmacies to buy the medicines because in Indonesia, a lot of pharmacies just close to the house. We can just cross the road and then buy the medicines. It's different from hospital, community healthcare, clinics, and doctor practice. But the second healthcare facilities visited by the respondents are going to the hospital, then community healthcare, clinics, and doctor practice. The question is the healthcare service deaf friendly? And then, wow, 100% said no. In Indonesia, all of them said no. Healthcare sectors, from the hospital, clinics, pharmacies, it's not accessible for them. It's not inclusive. And I'm so happy to show this emojis here. Like, it's not inclusive at all because from our interviews, we get a lot of stories from that. One, like over-reliance on verbal communications. All of the doctors, nurses, pharmacists really want to talk in verbal communications. A small number of them use sign language, and then we gather the stories from them. Like the respondent 5 said, everything is verbal, and they make no effort to use sign language or visual aids. Like communicate with deaf individuals, most of them use visual aids, not the audio communications. Respondent 79 said, I always feel left out because all instructions are given verbally and no one checks if I can understand. Like, okay, they just tell, oh, you are sick, and then you have to buy this medicines, and then that, oh, do you understand or not? They don't care. They just communicate just like, okay, formally I already done my job as a doctor to educate you as a patient, but if I understand or not, job, they say, they should, but respondent next house thing, trying to explain here with me in verbal communications. Yeah, who can communicate in this window. But and it's disappointing that no one is trained in this window, not even in big hospitals. We have thousands of hospitals in Indonesia. We have a lot of recommendations. Go to the hospitals that they have a big names, professional doctors, but none of them can communicate in this window. They cannot educate the deaf patients there. Doctors ask questions, but when I gesture or try to sign, they just look confused. Communication challenges due to mass usage because after COVID pandemic, all of us use masks, and it's getting or surface like must make it impossible to repeat. Like most of the verbal deaf individuals, they need to repeat. That's why when we have to communicate with them because they need to repeat to support what they hear with the limited hearing, and they will see what we say, right? Healthcare workers refuse to remove their mask, even briefly, making communication frustrating. And masks have made an already difficult situation worse, and I rely on lip reading, so masks have made healthcare visits unbearable. Insufficient use of written communications. Another story from deaf individuals that writing everything down takes too long, and staff often get impatient with me. Like, yeah, what is your problems? They tell everything writings, and it's hard, right? When I ask them to write, they sometimes refuse or rush through it, which makes things worse. Lack of sign language interpreters. Yeah, I'm the founders and also the supervisors in Indonesia. But for millions of people in Indonesia, we only have 114 sign language interpreters in Indonesia, with 60% of them, 60 people in Jakarta metropolitan area. If we go to the Sumatra Island, we will go back to the maps. We only have 3 sign language interpreters there, 0 in Papua, only 1 in Sulawesi, and we see that even for the public, it's limited how to have the sign language interpreters in the healthcare settings. I always have to bring a family member or hire a sign language interpreter by my own because there are no interpreters in clinics or hospitals. And yeah, it is another cost for the deaf individuals to provide to get the information about their health because they have to hire. If interpreters were available, it would make a huge difference in avoiding miscommunications. And I've never seen an interpreter in any hospital I have visited. Challenges with audio-based queue system. It's not just about the communication with the doctors, but it's also about the queue system because most of them are here, right? Queue number 10. Dina, go to the room. Like, we cannot hear anything, right? I often miss my turn because the queue numbers are announced verbally, or it's stressful to constantly rely on someone else to let me know when it's my turn. The other one is navigation issues within the healthcare facilities, like where to go, or there is no assistance because they don't know how to communicate. After 6 years in the deaf community, work with deaf community, I come to a conclusion that most of hearing people go to have a communication with deaf people. Like, I don't know how to sign, I don't know how to gesture. I ask them, do you know like this? Yeah. Do you know this? Yeah. Do you know this? Yeah. This medicine, right? Right. You do the medicine like this or like this, right? That's the medicine. They just know, but they are afraid to have a communication with them. That's why even for the assist deaf individuals to find someone who will assist them. When I ask for directions, the staff points fixedly, leaving me confused, just like there. And then, okay, where? There, then turn where, right? Limited access to public health information that I miss out vaccination updates on health or health programs because they are announced verbally, and public health campaigns doesn't consider us. Emotional and psychological toll. Another story from deaf communities that it's exhausting to keep explaining my needs. I avoid going necessary because it's so stressful. Going to the doctors, I'm afraid of with the needles. I'm afraid with the blood. I'm afraid with the medicine. But then it's getting worse. It's getting more stressful because they can't communicate with the doctors. Experiences of discriminations. At the clinic, they told me I needed a family member to accompany me because I am deaf, even though I'm perfectly capable of managing alone. This one comes from the hard of hearing individuals that, okay, you need to bring your father, your own mother, but that I can communicate, I can hear you, but please talk slower, slowly. I can understand what you say, and I can tell it to you what I need, what I feel about my health conditions. Doctors treated me like I didn't understand anything, like it's humiliating. They're just like, oh, okay, deaf. Okay, they just get the diagnosis without any proper do the assessment and things. Where the sign language interpreters in Indonesia here, were sign language interpreters in the healthcare service. Only in South Jakarta and Central Jakarta. It's only in Jakarta. When I asked from 138, only 3 people said I find sign accessibility preferences. Most of the deaf or professionals in the health settings who can communicate in sign language, but yeah, some of them say they need interpreters, some of them papers and pen, visual communication, and speech to text translations. But there's the utilizations when the deaf individuals go to the hospital. Most of them meet with the medical doctors and ENT, ear, nose, and how to say, throat. Yeah. And have you? And only 18 of them said yes. I have met someone, some doctors. And majority of them, 130, said no. I never met any doctors who can communicate in this Indo. And only in this province, 8 in West Java, 7 in Jakarta, 1 in Central Java, 1 in Riau Islands, 1 in North Sumatra, who said that I meet doctors who can communicate in this Indo. And types of Bisindo proficient doctors, most of them are then, because yeah, I know it's hard to individuals, and when see, oh, you're deaf, let's just communicate in sign language, right? Communication method, most of them still using the writing tools. It's like even the communication preferences in daily lives of deaf individuals using least of them in writing tools, but when they go to the hospitals, near the doctors, most of them using the writing tools. Okay, and only individuals that they go to the doctors using sign language. With the understanding level, most of them said moderately understand and do not understand at all. Like going to the doctor and the health conditions it's frustrating, right? And level of communications, most of them said it's difficult to communicate with the doctors. Let's go to the another healthcare professionals in the hospital that most of deaf individuals. And have you ever met with the healthcare professionals who can communicate in Bisindo? Yeah. 24 of them said yes, but 114 of them said 14 respondents said in West Java, 7 in Jakarta, 1 Bangka Belitung, 1 Central Java, and 1 in Sulawesi, in South Sulawesi. And who are they? Most of them are nurses and pharmacists, because most of them also meet with the nurses and pharmacists when they go to the healthcare services. Still, with the same communication method as in writings, like, okay, I need your hand, I need your date of birth, your mother's name, they do it writings. And sign language, only 11. Understand? Them say order, but still many of them say do not understand at all, and it's hard for them to communicate with healthcare professionals. But yeah, it's better than communicate with the doctors. Why this number is like this? Because communication with the doctors, we need to explain the story, this conditions, right? But when you go to the pharmacist, you just need, this is the the medicine's aim. Or you are already from the doctors. Let's just these are the discussions from the findings that most of the problems in this research is about the communication barriers, because deaf individuals face significant challenges in healthcare communication due to the limited availability of this, them using the writing tools and gestures which are inadequate for complex medical discussions. It's just like one sentence, one word, two words, right? Only 7.97% of consultations involve the use of sign language, indicating a critical gap in accessible communications. And then the second is about regional disparities, because most of the Bisindo provincial healthcare professionals are from West Java and Jakarta, right? And individuals are reflecting the need of on health understanding, because when you cannot communicate in sign language or there is no accessibility of sign language interpreters, we cannot explain what are the problems these deaf patients have and how to do the medications, right? About the diagnosis, the assessment, and everything. And the role of healthcare professionals, most of the deaf individuals goes to the medical doctors and also with to the dentist, the ENT, and pharmacists, because they are the most frequent healthcare providers met with deaf individuals. And there is the inclusive healthcare policies. Even the law is there. I said to you, the law number 8 of 2016 said that you have to provide accessibility trainings for deaf individuals and sign language. The law is there, but there is no reinforcement from the government, so this law can be pushed, right? And yep, for the recommendation, let's integrate the Bisindo training, provide systemic training for healthcare professionals, for the doctors, nurses, pharmacists, and etc. to enhance their communications and establish interpretation services, implement standardized sign language interpreter services both on-site and through remote interpretations. Even right now, we still have limited sign language interpreters in the country. We can have more in the future, but we need the system first. So you can hire deaf individuals. I am the founder of Para Kerja. I have deaf sign language interpreters that you can hire from us, but not. It's been 6 years for me being an interpreter. Never goes to hospital. I never give my service to the hospital, but most of them to the police office. Yep. And here, the last one is for the future research. This is my last slide, I promise. That you can help us to do the research in this field to evaluate interventions effectiveness, about assess the long-term impact of Bisindo training and digital. Focus on rural areas, not just in Jakarta and West Java, because it's a metropolitan and close to the capital city. And let's explore about the mental health implications for the deaf patients. Comparative studies learn from the countries with established languages, research the cost-effective and Bisindo training programs. So that's all about my presentations. Thank you for your attention and looking forward for your presentation. Thank you.
Thank you very much, Rezki. Time for a question? Yes, all right.
Yeah, I wonder how many sign languages there are in Indonesian, in Thai language. There are quite a few. And how can people communicate when there are different systems? Because in Thailand, as far as I know, there is the official sign, which is taught in school, in like deaf people's school, and there are kind of natural developments of people develop their own system. So just would like to know what is happening.
Okay, thank you for the question. So in Indonesia, we have the formal one is Indonesian Sign Language or the Bisindo, right? But the government, just like in Thailand, we also have that, but it's not sign language. It's a system of Indonesian language translated to sign language, just like what I want to show you. So, well, in Bisindo, I need you to see me. In Bisindo, when we talk about jobless people, the sign is like this. It's jobless. You don't have job, so you just like, okay, this is jobless in Indonesia. But in Bahasa, it's pengangguran, right? That's the natural one that like you say. The natural one, okay, you are jobless. It's the natural one. You don't have job, right? But then when you go to the government, the system one, it's pengangguran. It's penganggur and. What is anggur? Anggur is grape. So they use the how to say it, the words to and mix them, and it's not like how to say it?
Syntax.
Yeah, syntaxes. Yeah, to do that. So in Indonesia, it's not word. Even the natural one, it's from the deaf individuals. They gather, they have a communication. And then Indonesia, our government is very innovative and it's unethical actually because they are hearing people but they make their own sign. Just like in Indonesia, wake up and build a house. Wake up and build, it's the same word. It's bangun. Okay, so in deaf individuals, the deaf community in Bisindo, wake up is like this. That's wake up, right? And then when you build the house. But our government make it just like, yeah, so when bang is building a house, bangun rumah, and bangun tidur, which is wake up, will be like this. Like wake up should be supposed to be like this. You open your eyes, but when wake up is bangun tidur, bangun, and tidur, sleep. Oh, you are not supposed to sleep. You have to wake up, right? So, yeah.
Another words like democracy. I just looked up Thai sign language. They do something like this for democracy. I don't know what it means.
Why there is difference one. So okay, back to the class of sign language. The one who the deaf individuals, not by the hearing, approach us about how to make the sign, and that's not my capacity to answer because how to build to make a line is like that. So like this, I want to show you about one word in Bisindo, and we also have dialects. So every provinces have their own dialects. We can marriage. In my city, its name is Padang. Marriage is like go to the male one and the female one sit down together, and that's the interpretations of marry. But in Jakarta, marry is like this because you put the ring. Even the funny one in Batam, I work in Batam. Marry is like this because after you marry, you can sleep together. That's the marry. So why the sign is like this? We can ask them why the democracy the sign is like that, because they have their own interpretations for that, and we just need to respect. Like, okay, I just want to show you one basic sign. Thank you. And okay. In Bogor, it will be like this. In Bali, it will be like this. So it's okay. Thank you, thank you, thank you, thank you. In 4 different dialects. And why it's like this? Yeah, it's because of the cultures. That's my answer. Thank you.
Thank you so much. Very interesting presentation. Thank you. A few weeks ago, we graduated with a thesis defense for a few hours, and then thank you for coming. We're going to have one more
Thank you.
presentation before with lunch.